So friends, you already know about pregnancy test, early pregnancy factor, and biochemical pregnancy. And when can we diagnose pregnancy accurately? When do we talk about clinical pregnancy? If you are interested in this topic, watch this video. I'm Dr. Olena Berezovska and I welcome you to my video channel. First, let's talk about the gestational age. How is the gestational age determined? And when we talk about pregnancy as a diagnosis. So it is believed that pregnancy lasts an average of 280 days or 10 lunar months. The lunar month contains 28 days. Why don't we use regular calendar months? It turned out that by using the calendar, it is very difficult to determine the exact gestational age. When I was young and I was pregnant, the calendar term of pregnancy was most often used. But at the same time, doctors and midwives made mistakes, especially in determining the expected date of delivery and issuing maternity leave. But as soon as ultrasound appeared, they began to investigate the development of the fetus and its size by week, so the concept of obstetric weeks appeared. Now the gestational age is determined in weeks, not months. In addition, with regular cycles of 28 days, we determine the gestational age from the first day of the last menstruation. If the menstrual cycle is shorter or longer than 28 days, we adjust the gestational age by subtracting or adding the difference in days. Because with cycles of different lengths, ovulation does not occur on the 14th day of the cycle. If the beginning of the last menstrual cycle is taken as the beginning of pregnancy, then at the time of expected period, the gestational age will be 4 or 5 obstetric weeks. So the first month of pregnancy is a period from the beginning of the last menstruation to the delay of the expected one. Of course, if the cycles are not regular, the exact gestational age can be determined by another method, usually ultrasound. Even so, on average, we are talking about 280 days of pregnancy. This does not mean that the pregnancy should last exactly 280 days or 40 weeks. A woman can give birth before or after 40 weeks, and only 6–8% of women give birth at 40 weeks. Determination of the gestational age is often erroneous because not all midwives and doctors do it correctly. The most accurate gestational age can be determined using ultrasound in the first weeks of pregnancy, usually at 8–10 weeks. The level of error at this time is very low. I will talk about early ultrasound and when we do it, what we can find out in another video. Now let's talk about what a clinical pregnancy is. Doctors and midwives used manual examinations before the advent of ultrasounds and blood tests for hormones. But examinations were usually carried out when there was a delay in menstruation. Therefore, a delay in periods is the first sign of a possible pregnancy. Irregularity of menstrual cycles was and is frequent occurrence in women's life. Those women who planned pregnancy or did not protect themselves from a pregnancy found out about pregnancy after 1–2 months of delay in periods, sometimes with the appearance of nausea or vomiting. The delay in menstruation reminded a diagnostic criterion for the diagnosis of pregnancy. The second important criterion is confirmation of pregnancy at the hormonal level. The determination of HCG in the blood is another method for diagnosing pregnancy. The third criterion is the determination of the gestational egg using ultrasound. Ultrasound allows you to see the gestational sac, find out its placement, and if it's possible, detect the heartbeat of the embryo. And we are talking about clinical pregnancy in this case. If you notice, I didn't name manual examination as a diagnostic method or criterion, and I'll explain why in another video. We return to delay of menstruation. It turns out that 25% of pregnant women have spotting in the early stages of pregnancy, including at the timing of delayed menstruation. The amount of blood can vary from small spots to actual bleeding. The appearance of blood is not a mandatory sign of termination of pregnancy. This does not mean that everything is bad. The appearance of blood can mislead some women into thinking it is menstruation. There may be less blood than usual during periods. The reaction of women can also be different, from calm observation to great fear and worries. Most often, the discharge lasts no more than 1-2 days. If the discharge continues, you should contact your doctor or midwife to clarify the situation. This is why a delay in menstruation is not the most important criterion for the presence of pregnancy. After all, menstruation can simply be late, and we are talking about a delay in periods if it does not appear 7 days from the expected days. That is why we say the normal regular cycle are 21-35 days plus minus 7 days, which means the menstruation may appear early or late by a few days. With a delay in menstruation and no complaints, a woman can wait a few days and take the pregnancy test. If the test is positive, the chances of pregnancy are high. If a woman is sure that she cannot be pregnant, then she may wait for a few days to a week, depending on situation. Are there any signs of pregnancy that a woman herself can recognize? So many women planning a pregnancy listen to their body, look for any small deviations, and ask themselves the question, is this pregnancy or it seemed to me? Oh, I'm sick. Oh, my stomach hurts. Oops, my stomach is bloated. Oh, I saw a fish in my dream. Oops, my breast pricked. Am I pregnant? And on the other hand, numerous searches for pregnancy seem ridiculous. On the other hand, this is a sign that most women do know nothing about pregnancy or have too superficial an idea about it. So complaints about sore breasts are not the most accurate sign of pregnancy because in most women, the breasts begin to gradually increase and hurt from the 6 weeks of pregnancy. The fact is that the breasts can also hurt before menstruation as a manifestation of premenopausal syndrome. There is also a myth that if the breasts stop hurting, then this is a sign of a missed pregnancy. Soreness of the breast can be observed for several weeks and then adaptation takes place, their reaction decreases. And there are women who complain of constant pain in the breast throughout the pregnancy. The reaction of the breast is always individual. There is another symptom that is observed in most pregnant women in the first weeks of pregnancy. This is a frequent urge to urinate. Often such signals are mistaken for inflammation of the bladder, cystitis. It is very bad when a woman starts taking treatment without knowing that she is pregnant. Why are these frequent urges? The presence of a gestational sac in the uterus causes the uterus to begin to adjust to its new state. A lot of signals go to the lumbar nerve plexus, further to the spinal cord and brain. The feedback of the brain is that it does not always perceive the exact localization of the source of signals. Therefore, signals from the brain can also be sent to the bladder. It also begins to respond to pregnancy. The diagnosis of cystitis is not made by frequent urination. The biggest mistake is taking antibiotics without a correct diagnosis. It is necessary to do a urine test, while the urine must be collected correctly. Cystitis does not occur out of the blue. There must be a history, including past episodes of cystitis. If a healthy woman has alleged symptoms of cystitis while her pregnancy tests are positive, there might be normal reaction of the bladder to the pregnancy. Do not rush to take medication if you are not sure of your diagnosis. Many pregnant women complain of drowsiness and fatigue. This is a state of physiological hypoxia. This condition plays an important role for implantation. Also, with the onset of pregnancy, a woman becomes sensitive to carbon dioxide. So many women cannot be in enclosed spaces with poor ventilation. They easily pass out in stuffy rooms or while wearing masks. A change in the perception of smell is another possible sign of pregnancy. It turns out that in a pregnant woman, the perception of not all odors changes, but selectively one or two. Some smells become bad, are no longer pleasant, and even cause an unpleasant reaction, such as nausea and vomiting, while others, on the contrary, attract. We will talk about what basal body temperature is and how it can change during pregnancy in another video. I will also talk about the signs of pregnancy during a manual gynecological examination. If you are interested in these topics, follow my post by subscribing to my video channel. Don't forget to like my video, write comments, and invite your friends and acquaintances to my channel. You can also watch other videos and open the world of medicine and science in an interesting new perspective. All the best and see you soon.